Good day, my name is Byron Wilcott. This is Michelle. She'll be helping me demo some of these techniques. Today we're covering the first two stages of the corrective exercise continuum. First off, we'll be showing you some myofascial release. This is an inhibitory technique. After which I'll be showing you a static stretch and neuromuscular stretch. Okay, first off, myofascial release. We'll be doing a myofascial release of the gastrocnemius and the soleus, which are down here in the calf area. While doing these exercises, very important that your client has a stable core, has correct posture, they're relaxed, and they take their time and do not rush through this process. As well, there's different ways in which we can progress each exercise, and I'll show you this as we go through. There are many different techniques in doing this. You can use a foam roller, which is what we'll be using today. You could be using an exercise ball with various stiffness. This has very stiff, rigid edge to it. Can be very aggressive and too painful for some clients. So you can go with something slightly softer. As well, a rolling stick. This thing is great for most clients. It's easy to use and is client directed how much pressure is put onto the muscle, and very easy to use. But since this is the most well known, this is what we use today. So first off, like I said, we're going to cover the gastrocnemius and the soleus. So one leg, just put one leg up on top of the foam roller. The client will roll their leg up slowly back and forth along the foam roller. Nope, not too far, from the knee to the ankle. Make sure to hit the gastrocnemius and soleus until they find the most tender spot. Okay, from here the client can hold their leg here. This is fine. But to increase more pressure, what you can have your client do is take their resting leg and put it on top of this leg. Can you do that? How's that pressure? Okay, for more extra pressure, have the client raise their gluteus maximus off the floor, causing more pressure on that spot. At this point, you'll have your client hold this for about 30 seconds. Some clients who have less pain tolerance may have to put their butt back down, If that's the case, they can try to hold this up to 90 seconds. Ideally, they want to hold until the pain that they're feeling decreases significantly. One point to note on this is these exercises can be quite painful for clients at first, but after repeat sessions over and over, this will become increasingly easy for them. Especially the IT band. Most people I've seen who do myofascial release on the IT band find it extremely painful. Myself, I'm one of them. I find it really sore, but over time it will get easier. Next off, we're going to do a myofascial release of the hamstrings, or the main muscle back there, the bicep femoris. So we're going to have you roll down, put that underneath your legs, lift your feet off the ground, lift your butt off the ground if you can, and roll until you find the most tender spot. Okay, if your client finds this too painful, you can get them to lift up higher and rest their heels on the floor if you have to. This one here tends to be a little easier for most clients, so they should be able to hold this position. So again, they'll hold this for about 30 seconds or up to 90 seconds depending on how long it takes for them to feel the relaxation. Okay, and back off. Lift up. Just lay flat with your head there. Okay, the next thing we're going to cover are stretches. First off is a static stretch of the hamstring. So with your feet out straight, what you have your client do is to lift their leg, lift your leg, put your hands right behind here on the hamstring, leg straight, toe pointed back as far as you can, and pull your leg back towards yourself. All your client is doing here is relaxing the leg completely. All the strain is coming from the arms. Up. Sorry, there's our special guest. Okay, so the leg is relaxed. The strain is coming from the arm pulling back on the leg. They're going to hold this for 20 to 30 seconds. And once they're done 20-30 seconds, they're going to release the leg, let it relax, and back up again. One more time. They're going to do this for 1 to 4 reps, depending on what's comfortable for them. For clients who are 60 plus or 65 plus, they should be holding this stretch for 60 seconds. And back down. For the neuromuscular stretch, it's very, very similar to what you just did, but instead, hopefully you can see me in the video here, you have your client lift her leg up the way she just had it. Okay? You put the client's foot on your shoulder like so. Okay, you don't have to use your hands here. I have this now. You have your client relax their muscles as much as possible, and you're going to press up forward until they feel a good stretch. And they'll tell you, just wave your hand when you feel a good stretch. Okay. From here, you're going to have your client contract the hamstring, trying to bring the foot forward at a 20 to 25% their maximum contraction rate. They're going to do this for 7 to 15 seconds, with 10 seconds being ideal. So go ahead. Okay, relax. Once the muscles relax, you're going to press forward until they say, oh good, it's good. You're going to hold this for another 20 to 30 seconds. Okay, 30 seconds is up. What you're going to do is have the client again contract their hamstring muscle. Go ahead for approximately 10 seconds again. Okay, 10 seconds is up. What you have then is you're going to press on the leg again, bring it even further up until the client puts their hand up saying good. It's good again. Once again, they'll contract their hamstring muscles for 7 to 15 seconds, ideally 10. And then they'll relax, and you'll try to stretch a little bit more, and you'll hold it for 20 to 30 seconds. So, with the neuromuscular stretch like this, you want to be doing 1 to 3 sets. When you're doing it, you push the muscle up, you hold it for 20 to 30 seconds, you have them contract their primary mover at 20 to 25% their maximum muscle contraction. At that point, they'll hold that contraction for 7 to 15 seconds at ideally 10 seconds. Once they relax, release, go as far as they can again, that's comfortable, to the point where they're getting a good stretch, another 20 to 30 seconds, and you can do that up to 3 reps. So, what you've seen today are the first 2 stages of the corrective exercise continuum.